Hello, everyone. Good afternoon. I guess it's good to start now. So, a pleasant afternoon to everyone. Welcome to our Make Time for Your Health Lunchtime with Your Wellness MD series of lectures on staying healthy in the time of COVID-19. This is brought to you by the Center for Preventive Health and Lifestyle Medicine of the Medical City. This is actually the fifth lecture in this series. To recap, we had the impact of COVID to our health on day 1, obesity and nutrition during COVID-19 on day 2, stress in the time of pandemic on day 3, ergonomics in work from home setup on day 4, and today we will have a session regarding sleep issues in the time of COVID-19. How many of you have started experiencing sleeping problems recently? I'm sure a lot, if not all of you, have experienced sleep issues after enhanced community quarantine has been declared in March 16. This lecture aims to help you understand why all of a sudden we started having difficulty sleeping since the pandemic started. This lecture also aims to give tips on how we can improve sleep hygiene in order to strengthen our immunity and prevent not only COVID infection, but illness in general. So first of all, what is sleep? It is actually a natural process among living things, meaning it's normally a part of the body's physiologic processes. It should be automatically reversible, meaning we cannot be like Sleeping Beauty, waiting for a Prince Charming to give us a true love's kiss to be awakened from sleep. The body follows a circadian rhythm, or a clock-like cycle of alternating sleep and wakefulness, which is very important for a number of the body's processes to be regulated and to function properly. Sleep is the absence of wakefulness. We are unconscious of the environment when we are asleep. It is usually achieved in a lying down position with our eyes closed. Sleep is made up of cycles of non-REM, which is the quiet phase, and REM, which is the dynamic stage. REM stands for rapid eye movement. The cycles of sleep will be discussed briefly in the next slide. Sleep is associated with dreaming. Dreaming happens during the active phase of sleep, or what we know as a REM phase, and dreams are actually stories and images that our mind creates. During sleep, the brain activity and physiologic functioning are very dynamic. There are 4 stages of sleep. Sleep begins in non-REM stage 1. This is the transition period between being awake and being asleep, and would last for around 5 to 10 minutes. Sleep will then progress to stage 2. Non-REM stage 2 is when the body temperature begins to drop and heart rate begins to slow. This is to facilitate decrease of sympathetic and cardiac tone. This lasts for approximately 20 minutes. In non-REM stage 3, muscles begin to relax. Blood pressure and breathing rate drop, and deepest sleep occur. After stage 3, stage 2 sleep is repeated before entering REM sleep. In the REM, the brain becomes more active. Rapid eye movement happens at this time. The body becomes relaxed and immobilized, and dreams start to occur. Once REM sleep is over, the body usually returns to stage 2 sleep. Sleep cycles through these stages approximately 4 or 5 times throughout the night. Sleep is induced by steady rising of melatonin, which is a hormone that is produced from the pineal gland of the brain. This is triggered by darkness. Melatonin secretion leads to shift of body temperature from the core to the extremities. Throughout sleep, melatonin will plateau and will gradually decrease upon the rising of the sun or exposure to light. Cortisol, which is the stress hormone, will begin to increase at this time. Increase of cortisol will lead to increase in core body temperature, leading to increase in blood pressure and sympathetic tone that will eventually lead to awakening. This slide shows the graphic representation of the circadian cycle of the melatonin and cortisol peaks and drops that is correlated with the rising and the setting of the sun. Green line represents cortisol that is shown to rise upon sunrise and declines upon the rising of melatonin in sleep. Red line represents melatonin that is inversely related to cortisol levels seen to rise at night and decreases upon sunrise. Think about stress, any kind of stress for that matter. To relate it to our present situation, think of stress brought about by the pandemic. Stress leads to persistently high blood levels of cortisol, which may suppress melatonin production, hence leading to failure of sleep induction or a disrupted shallow kind of sleep. We tend to think of sleep as a time when the mind and body shut down, but this is not the case. Sleep is an active period in which a lot of important processing, restoration, and strengthening occurs. Hence, a very important process that the body should undergo. This is according to the National Sleep Foundation. So why do we need to sleep? What are the benefits of sleep to us? Sleep helps us in solidifying and consolidating memories. That is why an effect of chronic loss of sleep is becoming forgetful or having what we call as foggy brain. Sleep helps us rejuvenate and reboot. Sleep helps in the process of growing muscles and in the repair of tissues in our body. Having good sleep helps our body in healing when we have body injuries or when we are sick. Sleep helps in the synthesis of growth hormone. I'm sure all of us have experienced being told by our parents when we were young that we need to sleep early and to avoid losing sleep so that we will grow tall and strong. It is actually backed up by scientific evidence. Do you remember the hormone melatonin? Melatonin peak production in deep sleep has to happen for growth hormone production to be efficiently released. Imagine kids who sleep late or who sleep inadequately. They will not be able to produce adequate growth hormone levels, hence can lead to stunting. We need sleep to conserve energy so that we can wake up to a new day feeling refreshed and recharged. Sleep also plays a very big role in the development of the brain. This is the explanation why babies would sleep for 13 to 14 hours in a day. What happens when we lack sleep chronically? Remember the movie 10 Things I Hate About You? For all of you millennials out there, eto naman 10 things we hate about losing sleep. First, there will be increased risk of accidents, such as car accidents that happen when sleepy people drive. Job accidents are also likely to happen when one is sleepy. Foggy brain is when we have impaired attention, alertness, concentration, reasoning, and problem solving as a result of lack of sleep. Foggy brain can result to less efficient learning and memory deficit, as well as being forgetful. Third, lack of sleep also impairs judgment. Fourth, when we lack sleep chronically, we also increase our risk of developing chronic, non-communicable diseases such as hypertension, heart disease, stroke, diabetes, and many other diseases. Do you know that lack of sleep causes less effective insulin sensitivity? Insulin is another hormone. It is the hormone that decreases blood sugar level, hence decreased insulin sensitivity may lead to diabetes. Fifth, do you know that lack of sleep causes certain hormones related to appetite, which is leptin and ghrelin, to be poorly regulated? So when you are sleepy, yes, you are grumpy and would want to eat carbs to feel better. This is why we gain weight when we are chronically deprived of sleep. Yes, you can also blame lack of sleep why you can't lose that unwanted excess weight. Sixth, chronic lack of sleep also kills the sex drive. Seventh, lack of sleep or insomnia is often linked to depression. We can actually say that lack of sleep can promote depression. When someone experiences insomnia, it might be wise to also ask for other symptoms of depression so that treatment can be administered right away. Chronic lack of sleep makes us less pretty. It's because cortisol, the stress hormone, aids in the breaking down of collagen, leading to bad skin. Too little growth hormone, which also helps in tissue repair, is also an effect of lack of sleep. Ninth reason, yes, lack of sleep can affect your immune system. Studies show that people who don't get quality sleep or enough sleep are more likely to get sick after being exposed to a virus, such as a common cold virus. Lack of sleep can also affect how fast you recover if you do get sick. Overall, lack of sleep increases risk of dying. So COVID-19 came. Enhanced community quarantine was declared over NCR. all of a sudden you find yourself having difficulty inducing sleep. Or you wake up tired, feeling that your sleep was not that rejuvenating. Indeed, the disruption of our daily routine, the fear of being infected with the virus or transmitting the virus to our family, leading to isolation from our family and friends, losing jobs because of the closing of business establishments, financial insecurity, all of these are enough to cause anxiety and worry, leading to troubled sleep. A lot of us were forced to work from our homes. Kids were forced to do distance learning. This led to greater family and work stress. Working or studying from home has increased our use of laptops and mobiles, and if we are not able to regulate this, excess screen time can decrease melatonin secretion, hence leading to difficulty sleeping. Eventually, stress-related fatigue is experienced. So going back to the list of 10 things we hate about lacking sleep, we wouldn't want these things to our body happening to our body, especially during the time of pandemic. We have to ensure good sleep, especially at this time, because we don't want our immune system to be less efficient, resulting to us being more sickly, hence increasing our chance of dying. We also wouldn't want a foggy brain, because even if we are staying at home, a lot of us are also still working. Hence, we would want to be sharp and capable of decision making. Staying at home and not being able to do the things that we used to do can also affect our mood and disposition, and not being able to sleep would cause us to be sadder or grumpier. It is during times like this that all the more we want our mental health to be intact. Experts agree that getting consistent, good quality sleep improves virtually all aspects of health, which is why always striving to get enough hours of sleep, even when there is no pandemic, is one of the great things that determine our health. So what are the tips that can help us sleep better during the pandemic? According to the National Sleep Foundation, first, set your schedule and routine. Sleep-specific aspects of your daily schedule would include a wake-up time, wherein you set your alarm, bypass the snooze button, and have a fixed time to get every day started. You should have a wind-down time. This is an important time to relax and get ready for bed. It can involve things like light reading, stretching, and meditating, along with preparations for bed like putting on pajamas and brushing your teeth. Given the stress of the coronavirus pandemic, it's wise to give yourself extra wind-down time each night. Warm shower can also help induce sleep by regulating core body temperature that is essential in secretion of the sleep hormone melatonin. Drinking something warm like a hot herbal tea, not caffeine-containing wansa, and certainly not milk tea, can aid in inducing sleepiness. For bedtime, pick a consistent time to actually turn out lights and try to fall asleep. In addition to time spent sleeping and getting ready for bed, it can be helpful to incorporate steady routines to provide time cues throughout the day, including showering and getting dressed even if you aren't leaving the house. Eating meals at the same time each day, blocking off specific time periods for work and exercise. Second tip, reserve your bed for sleep. Sleep experts emphasize the importance of creating an association in your mind between your bed and sleep. For this reason, they recommend that sleep and sex be the only activities that take place in your bed. This means that working from home shouldn't be working from bed. It also means avoiding bringing a laptop into bed to watch a movie or series. Limit screen time. Avoid using your gadgets or watching the TV when putting yourself to sleep. Blue light from the TV and gadgets disrupt sleepiness. As much as possible, avoid using these devices for an hour before bed. You can also use device settings or special apps that reduce or filter blue light. Also, the fad nowadays, telenovelas can get you addicted enough to trade sleep to finish all the episodes. Or watching the night news might bring about unnecessary worries. That is why these kinds of activities should be avoided at bedtime. Third tip, see the light. Exposure to light plays a crucial role in helping our bodies regulate sleep in a healthy way. Remember the graph of cortisol and melatonin levels in relation to time of the day? As you deal with disruptions to daily life, you may need to take steps so that light-based cues have a positive effect on your circadian rhythm. If you can, spend some time outside in natural light. Even if the sun isn't shining brightly, natural light still has positive effects on circadian rhythm. Many people find outdoor time is most beneficial in the morning, and as an added bonus, it's an opportunity to get fresh air. As much as possible, open windows and blinds to let light into your home during the day. Again, be mindful of screen time. Fourth, be careful with naps. If you're home all day, you might be tempted to take more naps. While a short power nap early in the afternoon can be useful to some people, it's best to avoid long naps or naps later in the day that can hinder nighttime sleep. Try to limit nap times to 30 minutes to not more than an hour. Nap time should not be after 4 p.m. Fifth, stay active. It's easy to overlook exercise with everything happening in the world, but regular daily activity has numerous important benefits, including for sleep. But please avoid doing your vigorous exercise 3 to 4 hours before target bedtime. We don't want to stimulate cortisol few hours before sleep. However, doing your regular exercise in the late afternoon can facilitate deep night sleep. If you can go for a walk while maintaining a safe distance from other people, that's a great option. If not, there is a wealth of resources online for all types and levels of exercise. Many gyms and yoga and dance studios are live streaming free classes during this period of social distancing. Sixth, practice kindness and foster connection. Remember that only physical distancing is required and definitely not social disconnection. Seventh, utilize relaxation techniques. Deep breathing, stretching, yoga, mindfulness meditation, calming music, quiet reading can all help in inducing relaxation. Remember the sheep jumping over the fence technique? It's actually a form of a mindfulness activity for kids to induce sleepiness. 8. Watch what you eat or drink. Don't eat a lot of carbohydrates before bedtime. Don't drink too much alcohol as this might lessen the REM sleep stage from setting in, hence sleep is not restful. Drinking something warm like a herbal tea before bedtime can help induce sleep as this helps in temperature regulation important for melatonin secretion to increase. Lastly, if you tried doing everything and yet you really find it difficult to sleep and you think lack of sleep is already affecting your productivity, do not hesitate to contact your doctor. Additional tips on sleep hygiene: invest on a good quality bed. Minimize bedroom noise as much as possible. Alarm clocks should be out of sight, or any clock for that matter, because watching the time can cause us to lose sleep because we get anxious of not being able to wake up on time. Wear comfortable clothes, not too cold, not too warm. This is to facilitate cooling down of core body temperature that facilitates. Allow gradual regulation of room temperature so that your body can adapt easily. Avoid coffee and caffeinated beverages 6 hours before target bedtime for obvious reasons. Avoid smoking near bedtime, or you may want to quit smoking altogether since it has no health benefits anyway. Hydrate yourself well during daytime to help in the regulation of the osmolality or thickness of the blood, which is connected to the body's process of blood circulation and temperature regulation. However, avoid drinking lots of water near bedtime to avoid waking up in the wee hours of the night. I'm sure a lot of you wants to ask if it's okay to take melatonin to help attain good sleep. Be sure not to take melatonin supplement without a doctor's prescription, primarily because there are different kinds of sleep problems and not all sleep problems can be addressed by taking melatonin. Melatonin doesn't work for everyone. This paper actually summarizes which patient population seems to respond to melatonin treatment. This table may be too technical, but I just wanted you to see that the conditions that melatonin seems to have an effect on are those with jet lag, those with insomnia, and among healthy volunteers, it somewhat helped in the initiation of sleep and in the efficacy of sleep and in the induction of daytime sleepiness. Overall, results from this review suggest that melatonin shows promise to prevent phase shifts from jet lag and improve insomnia in otherwise healthy adults, but to a limited extent. The use of melatonin in shift workers is inconclusive. More high-quality studies with large sample sizes and power are needed to increase the confidence in the estimate of the effect. So in summary, we've discussed the following: the definition of the sleep, stages of sleep, physiology of sleep and the circadian rhythm, health benefits and effects of lack of sleep, challenges to sleep in the time of pandemic, tips on improving sleep hygiene, and use of melatonin supplement. I personally gather my inner peace and inspiration, especially during this time of pandemic, from God's Word, the Bible. I also think that being able to have a good quality sleep every night is a blessing from God. This verse is very fitting for today's topic. In peace I will lie down and sleep, for you alone, Lord, make me dwell in safety. So make sure to sleep tight every night from now on. So lastly, before I end, I would like to encourage everyone not to be fearful and anxious of COVID-19. Instead, let us be wise in going back to our normal activities by practicing the new norms of protecting ourselves and others by always washing our hands, wearing a mask at all times, practicing physical distancing, and avoiding touching our face. So together, let us achieve health and fight COVID-19. Thank you all for your listening.
Thank you, Doc Kat, for the wonderful presentation about sleep. Actually, last week, there were already questions that were being raised about sleep. So I'll just retell them today in the hopes that you might actually answer them. One of the questions before was pertaining to whether sleeping at night versus sleeping at day, which is much more beneficial for our bodies.
Okay, so of course, sleeping during the nighttime is the more physiologic time to sleep because of what I've shown earlier, that the graph representing the representation of the timeliness of the setting of the sun in relation to the melatonin and cortisol levels, no? So it coincides when the sun sets, the melatonin should go up, and that melatonin surge would help you induce sleepiness. So of course, if a person sleeps during daytime, it would be difficult for that person to imitate the nighttime wherein there is darkness, no? So it can be done. We can actually train the body, but usually that's the issue, to imitate the actual environment of having nighttime setting. So for most people, they find it really difficult to sleep during daytime. So there. From Mr. Bolina, at least how many hours of deep sleep does one need to have a good restful sleep? So this is actually, when we put in deep sleep, that's actually very difficult to quantify, no? Pero in general, 6 to 8 hours of sleep that is restful. Ang hirap kasing i-determine no how many, di ba I discussed earlier that you have to cycle to stage 2, 3, and REM many times in the evening. So that's actually very difficult to quantify, no? Pero make sure that you attain at least 6 to 8 hours of sleep per night. That's generally for adults, ano? So there. And then next question is from Miss Lenny. Can insomnia happens to kids, say 10 to 12 years old? Of course, lalo na sa dami ng environmental exposure nowadays, no? Primarily media, multimedia, no? So they will be tempted to look at their phones, they will be tempted to watch all the series in Netflix. So when they train their bodies to do that every night, sleeping late, like 1 o'clock, 2 a.m., it's gonna be difficult for them to sleep properly in the nights to come. So in that way, insomnia can happen, no? So that's why we have to also take charge of supervising our kids in terms of limiting their use of their phones and multimedia, no? So that emphasize to them how important sleep, getting enough number of hours of sleep to their health. So I hope I'm able to answer that question. So next question, is there some counting sheep method for adults? Yes, there's actually a lot of meditative activities that can be done by adults, you know. As simple as closing your eyes and trying to empty your mind, that's also already a form of meditation. So it actually depends on what will work for you, no? For others, meditation can be in the form of imagery, like looking at the picture or maybe forming an image where they want to go to, like a beach, with imagining all the effects of going into the beach, like hearing the waves, looking at the sky, no? So different kinds of activities that can be in the form of meditation, but it depends on the person what will work for them. Meditation app, yes, there's also a lot of downloadable apps that can be used to help you in this meditation activity. So we encourage everyone to like do meditative activities regularly, because it helps our health in a lot of ways, no? Not just in inducing sleepiness. So next, my son, a young adult, sleeps from 2:30 a.m. to 11 a.m. Supposedly, kasi 2:30 a.m. to 11 a.m. is more than 6 to 8 hours. Pero again, going back to the cortisol and the melatonin levels corresponding to the time of the day and the setting of the sun. So if you sleep at 2:30 a.m., it might be difficult to get to the restful, to the deep part of sleep, no? So kasi it should happen in a timely manner, eh. Kaya siya tinawag na circadian rhythm. Kasi meron talagang time wherein the melatonin will surge up, and then core body temperature would cool down, and then we would go into the stage 1, 2, 3 of sleep, and eventually REM. No? So if we disrupt that pattern, medyo mahihirapan yung body natin to adjust accordingly. No? So siguro aside from the time of sleep, important din yung pattern that we set our body to. So, there. Next question, daming question, no? Pero okay lang. We can answer the questions until, sige, basta. Next question, could you talk more about correlation of warm shower and warm drink to going to bed early? What's the scientific explanation? So, warm shower and warm drink actually helps in more of temperature regulation. So, when you shower with warm water or drink something hot, the temperature would shift towards the extremities of the body. So it will lead to the cooling down of the core body temperature. Cooling down of the core body temperature is very important. Parang imagine natin yung hibernation in animals. It's a form of short hibernation when we sleep, kasi we slow down all the physiologic activities of the body when the core body temperature cools down. So that is helped by doing warm shower and drinking something warm when we go to before we go to bed, no? So next, ayun, nasagot na natin yon. Healthy, a young adult, 2:30 to 11. So I think we were able to answer every question in the chat box. Meron pa ba? Ayan, meron pa isa from Jules. My 3-year-old toddler sleeps at 11 p.m. and wakes up at 9 a.m. Is that sufficient? 11 p.m. Depends kasi on the reason why they sleep at 11 p.m. So, of course, again, it depends on how since toddlers sila, so they don't have control of their time yet, it depends on us adults or parents to actually be the one to set the schedule for them, no? So again, going back to the melatonin, siguro I go back to that slide. This one. So if you can see in this graph, So the cortisol should go down at around 6 p.m. And that is aided by parang quiet time. You can actually do activities that should quiet down your kid, no? Like setting the tone of the bedroom to bedtime na, dimming the lights, no? Making the environment quiet, no? Syempre, wala nang TV or radio or anything, and then dim lighting lang, no? So, siguro around 6 to 7 p.m. dapat sineset na natin ang quiet na yung mood for the to allow the cortisol levels to go down. And then, going down of the cortisol levels can actually allow for the melatonin level to go up. And that would induce sleepiness, no? So, ang maganda kasi sa toddler, pwede pa natin silang i-train kasi nga it's actually us who should determine, ano, I mean, what's healthy for them or not. So, to answer that question, if you can adjust the sleeping time to earlier, that would be better for the health. And the growth hormone, kasi very important din yun pala. I forgot to mention. Melatonin peaks happen at 12 midnight, around 12 midnight. So if we miss that, the growth hormone will not be sufficiently secreted to promote growth, ano? Especially for toddlers. So, if you have more questions, don't hesitate to reach us by email or the numbers na shino namin in the last slide, no? So with that, we end this webinar. Thank you all for your questions and for your participation. So we have 2 or 3 more webinars in the upcoming days. So I hope you can also be able to attend that webinar. So thank you, everyone. Good day.